Welcome everybody to the Hutchinson City Council Special Emergency Meeting for Tuesday, March 17th, 2020.
Mayor and Council, thanks for coming in tonight. This looks a little bit different than what we're probably used to. We're doing our best to meet the social distance recommendations that have been set out, and so we'll have some conversations, obviously, about future council meetings and potentially what that will look like. But what I want to do is, in consultation with the mayor, he did call this emergency special meeting tonight, and some of this is mainly just to share with the council and obviously the public kind of what's going on within the community right now, what staff is working on. We've got both Chief Giverson and Chief Schumann here that will share a little bit on some of the things that they're working on, just so from a council's perspective and even from the public's perspective, you guys have a better understanding of what's kind of going on here at the local level. Obviously, a lot of the communication that's been coming out has been at the state and federal level, but there obviously are things that we're working on here at the local level, and we're doing our best to keep both staff and the public up to date as much as we possibly can, utilizing our social media and even our website. And I'll highlight some of that for the council and the public, just so they have an understanding of what's kind of out there for them. And so what I want to do, and I didn't want to spend a lot of time on this because I think we've heard a lot about it within the local or within the news and the media, but at least just for the council to have an understanding of where we're at today. This is the most up-to-date data that we have for Minnesota. This was as of, I think, this afternoon. They've tested just over 2,300 patients with 60 positive cases. And I know this map's a little, well, actually it looks better on the screen. Kind of gives you the highlights of where those tests have come in, those that are positive. Right now, to our knowledge, there are no confirmed cases within McLeod County. And so that's something to keep in mind. And why is this important? Why are we taking a look at this? And I thought for those of us that sat in on the League of Minnesota City presentation, I thought they did a pretty good job of kind of highlighting it. And just for the council's knowledge, this was kind of a look at how infectious this disease is compared to some of the other things that we've been faced with. Don't ask me to get into the reproduction number. That's for scientists and health officials that know a lot more than I do, but that just kind of gives you a pretty good comparison of the infectious rate of this disease compared to some of the other ones that we've been faced with. Obviously, measles and smallpox is at the high end of the infection, but we've got vaccinations for things like that. And so this is a little bit more potent than influenza. But we've heard a lot of conversations about MERS and Ebola and SARS, and that kind of gives you an idea of where that falls in line in regards to how infectious it is. One of the things I think that it's important for us to have an understanding of, especially from a council standpoint, is the fatality rate for something like this within our community. A lot of times people can refer to it as just no different than the seasonal flu, and you'll see what the seasonal flu impact is, which is 0.1% of a fatality rate. The COVID-19, based off of what they've seen to date, has a 2.3% fatality rate. You look at that number, saying that's not a large number. Well, you compare that to 0.01. You take that in regards to the city of Hutchinson, you take 14,500 people, 2.3% is roughly 330, 340 people. Put that at that scale, it's a little bit more of a concern for us, and it's the reason why we're involved. Yes, 80% of the population may not see any effects of it, but we know it's our responsibility to oversee the general welfare of the whole community. And so obviously there's 20% of the population that face a severe risk of being impacted by this. And this is why we're seeing a lot of what's taking place within the communities right now. Steve, did you have?
Yeah, I guess when I look at that too, I think, they use the number of like 35,000 fatalities from the flu, at that 0.1%. So if we're looking at 10 or 20 times that could be 700,000 people nationally.
Yes.
So that's really the importance of trying to limit the spread of it.
You know, we've talked about, and this, like I said, there's a lot of good stuff the league put out, and you've heard a lot of this, is, you know, a lot of the actions that are taking place right now is this idea of flattening the curve. And that's really what's being done at the state and federal level, which obviously has an impact at us at the local level. And I think the league did a pretty good job of kind of the phases of a pandemic. We're really in that community mitigation phase right now, and obviously some areas are probably more in that pandemic management range. And so just kind of wanted to highlight some of that as we have this conversation, and as staff gets into some of what we're working on and what we're doing within the community. One last thing too, and we've done a good job, hopefully we've done a good job of trying to share this stuff on social media, but this is our front page of our website, and right on the front page there is a link that we've done our best to try to put all the up-to-date information, including many of the links that are out there for anybody who has questions who may be looking to get some additional information on SARS, like I said. And we're using this time obviously to also kind of push that information out on the social media. It's probably the most active we've been in regards to social media and getting that information out there. And so that's, like I said, I didn't want to spend a lot of time on the background, but I thought those were some important things to highlight for the council as we get into conversations on this discussion and what's currently taking place and what we potentially may be looking at doing in the future. So any questions on that? Like I said, a lot of information, but there's a lot more that's out in the media, and obviously you can spend some time going and taking a look at this. So if there's no more specific questions on some of that information, I'm going to invite both Chief Schuman and Chief Kifferson just to kind of come up and just kind of share with the council some of what's been going on, at least on the emergency management side of things.
Hello, Mayor and Council. Really, I think what our goal here today is just kind of give you an idea of where we're at as a city in terms of our preparedness. And I think the simple answer to that is I think we're doing fairly well. Again, as Matt had mentioned, there are no confirmed or reported confirmed cases in McLeod County or Hutchinson at this point. I think when we get to that point, and I guess I will say when and not if, because it seems pretty apparent that will be the case, then we can start to look at different strategies and mitigation strategies at that point. As far as the police response, police department's response at this time, and the fire departments for that matter, we have implemented some different policies or protocols, I should say, for our response, mostly to medicals. And in our PSAP, we're going to be asking some screening questions just to get a better idea of what the call entails before we just send somebody to the call. We are going to be doing our best to return phone calls more than sending an officer to the house in non-medical calls. And for medical calls, we'll be, again, asking those screening questions so we can determine if there is a suspected COVID-19 exposure there. If we determine that that's the case, then we are not going to respond. Obviously, we'll be forwarding that call to a line, and the line of dispatch will do some more screening and dispatch a line of ambulance to that call. But obviously, we'll be in the area. If when a line reaches the scene, they determine that they need help or there's something else going on, either trauma or there's a crime that's been committed, something like that, then we will utilize our personal protective equipment, which at this time for the police department is going to be gloves, eye protection, and then N95 masks. And you know, as this goes further, we may revisit the idea of the N95 or the gowns, the disposable gowns. But that's something that we're not utilizing at this point, just due to officer safety issues. around that. Do you want to address some stuff with the fire department before we get more general about the city as a whole? Sure. Okay.
Good evening, Council and Mayor. Just to extend on that, from the fire department side, as far as the response is concerned, we're doing the same thing as far as trying to kind of filter the calls. We go on at least a dozen a month officer-only calls. A lot of those now we can screen on the front end, call back, try to mitigate over the phone if we can. Really trying to use the doorway of the house, kind of a threshold of the door as a barrier of do we need to go in or not. And we met with our staff last night. We had kind of a split training last night, so we talked to the staff on, making those decisions, their safety, their family safety is first and foremost. And we want to make sure they have a comfort level of what we're doing. We have all of the PPE needed for any level of exposure depending on how far this thing goes. But we've made some internal changes then in regards to, again, the officer-only calls, the medical calls, anything that's a very high priority, cardiac, stroke, trauma, we're going to respond as normal with just a little bit of extra PPE. All of our, fires, car accidents, rescues, those, again, responding as normal with modified PPE as needed. But we're going to put a lot of onus on our incident commanders to make sure that they are relaying information from dispatch and whoever else is coming to the calls. What do we need for resources, and really trying to limit the exposure to our people and limit the exposure to our resources as well.
Mike, you guys met with the county this morning, correct?
Yes. Both Chief Gifferson and myself were on a countywide call this morning that encompassed law enforcement, EMS, fire, the hospitals, the schools, emergency management. Who else?
Senior facilities.
Yep, senior living facilities, kind of just getting a holistic look at what is everybody doing, what do they have, what's working, what do they need help with, et cetera. I think that was a good snapshot of our county, our community, as far as where we're at. I don't believe there was any overwhelming concerns in there. I think everybody's doing what they feel is correct at this time, and have the right guidelines and protocols in place. So.
Mike, maybe touch on, there has been inventory done of all the supplies that.
Yeah, about 2 weeks ago, all of the agencies submitted inventories of what they have. N95s, gowns, glasses, SCBAs, whatever. So we've got a list of what everybody has. So as things move forward, if there's a need, we know who has a lot and who doesn't, and maybe there's a movement of resources from one agency or city to another. So
When you say agencies, is that PDs, fire departments?
everybody, yes.
And cities, but then the sheriff, or also schools,
Realistically, I would say it would be law enforcement, EMS, and fire in our more local area.
Yeah, okay. Just trying to understand what you meant.
Okay.
And I guess I'll just add, I suppose what I said about it. I'll add, I think Mike and I both are very confident that the resources that we need at this time, we are sitting good. I think we're probably very well prepared, especially when you start to consider Hutch Health and their preparedness along with ours. I think we're sitting in a good place. There's no real way to predict where this is going to go. But again, as it sits today, we're fine, and I think we have enough resources to get through this for some time. So if you're concerned about that, obviously there's other private entities that were part of this meeting that are a little more concerned about that than we were, and that's where those shared resources may come into play. But I'm confident that manufacturers like 3M will be able to start to meet the demand for some of the supplies that we need. They've already made a huge commitment nationally to do that. So I like to think that the more local we get, and since they are a local company, not just Hutchinson, but Minnesota, they'll, again, be able to meet the need that's there. As far as citywide, I'm sure you're all aware, some of the governor's orders. From the police department side, it was mentioned earlier, the school district has done a number of, our first responder side, the school district has done a great job of communicating with us, their desire to make sure that there's childcare and that type of thing, so we're not really too concerned about that. As far as the governor's orders closing, mandatorily closing certain businesses within town, I think we have a good idea of how we need to respond to potential violations of that order, and so I'm not concerned about that either. All in all, I would say there's been great communication within the county amongst all agencies to head this thing up and do what we need to do. So I guess I would open it up to questions from you guys at this point.
I guess I just want to say that I'm sure that the rest of the county, the smaller communities, are going to be looking towards you guys because they don't have the resources that we have. So I'm sure that was brought up at your meeting.
Yeah, ultimately, we'll have to work through some of those things, that, you know, whether that looks like mutual aid or some kind of emergency joint powers agreement. If it gets to that point, we'll have to work through that when the time comes.
Tom? Before you sit down, do you want to address really what a 911 call is? They shouldn't be calling you to find out where they're getting toilet paper tomorrow.
Correct. I don't know if you heard the same thing on the radio that I did today, but
Of course I did.
apparently out in Oregon, the police department actually had to make a public statement
Right.
saying 911 is not the place to call if you're out of toilet paper. So apparently they were getting numerous people using that service for the wrong thing. So, but yeah, if it's an emergency, absolutely 911, Sheriff's Office, Hutchinson PD, the fire department, we all have administrative lines too. If you need information, that would be the appropriate number to call. Obviously, it all rings into the same place, but we prioritize calls based on how they come into the PD. And again, emergencies take priority over everything else. So if you have an issue for the city or the police department, please use the administrative lines. 911 is for emergencies only. Does that make?
Thank you.
Okay.
As far as the discussions with the other entities, I'm glad to hear that. Sounds really comprehensive. Was there like a schedule set up to have updates or, you know? Or
Sure. What the meeting this morning really consisted of is just finding out who all the partners were in the community, and then just get a very basic understanding of where everybody is, what do you need, what do you have for questions, and I think we're going to follow up with that. It may not be as comprehensive as today's meeting was, but obviously county emergency management, all the city emergency managers, and then other players in that as well will continue to meet in that regard. And again, just so you're aware, these meetings, when I say a meeting, it's a go-to meeting, so it's either over your computer or telephone. Everybody stays in their respective offices.
Sure.
Thanks, guys. I'll kind of jump in and you guys can fill in too. Obviously, we talked about the governor's state of emergency and how that impacts us. You know, one thing that I wanted to address, and I'm not looking for a decision tonight. It's something obviously for you guys to talk about is, this discussion on the city declaring a state of emergency. We are seeing that throughout the state, that cities are declaring that state of emergency. In my conversation with both Mike and Tom, at this point, we don't feel there's a need for Hutchinson to do that, because it essentially opens up services for us that right now we're not in need of looking for. And the benefit of where we are in Minnesota is that at any moment, the mayor can call a state of emergency. So I guess, I'm not saying we don't have to, but I think we're not here tonight saying that the city needs to declare a state of emergency. And I don't know, Tom, if there's anything more to add regarding that and some of the benefits there is in calling one. Sure.
As you probably are aware, state of emergency really allows the city as a whole, or the decision makers for the city, which is you guys, to do certain things that are outside of the normal procedures for public bodies. First off, state of emergency is going to allow you a lot of FEMA aid. It also allows you to make purchases, large purchases outside the normal method of doing that. And again, in our conversations this morning, we're just not to that level yet. I mean, I don't want to get to the point where, okay, now we've incurred all these expenses and we would be eligible for reimbursement, but because we haven't declared a state of emergency, those expenses aren't reimbursable. But on the same hand, I think there's something to be said about declaring that when it's actually needed versus as a preparatory thing. I think there's no need to cause undue anxiety with the public. The entire population isn't going to understand what a state of emergency is. Even if you call it a peacetime state of emergency or what have you, there's still that stigma that's attached to it. So, as Matt alluded to, that's something that can be done almost instantaneously. And so if we start to see as a city staff that we're starting to incur some pretty heavy expenses, then maybe we look at doing that. That's just my opinion. Obviously, you guys are the decision makers, but that's where, I guess, what we came to earlier today. Any questions regarding that?
One thing to keep in mind too, with the way we're set up, I've been given a lot of authority over the staffing decisions. And so that's some benefit to where, you get some locations where the elected officials make some of those decisions and it would make sense to declare some state of emergency. Now, I'm here tonight to tell you if that's something you want to do, it doesn't hurt us. But at this point, we don't feel like there's a need for the local government to declare one. So, but like I said, obviously we're open for those conversations. We can have that a little bit later. No, this first part, we're trying to share a lot of information, so feel free to stop, ask questions as we kind of go along. And so what I want to do is kind of jump into what we're currently seeing for some of the impacts on, first, we skipped over a little bit. One of the things I did hand out to you was the city's pandemic response plan. One thing to note, and this is, as we looked at this, I think we'd all admit, from a staff's perspective, this hasn't been looked at since 2007, and that's probably a mistake on our side. But with that being said, the plan that's been laid out does have some pretty good basic guidelines that we're within and we're looking at. And I would note there's a matrix on that last it was a single attachment that kind of gave us some of the steps that we're to be following, and I would say we're from a citywide, we're really in that kind of level two area, and I would say when you look at the actions that we're doing as a staff, it's quite consistent with what's been called for in that level two portion of the matrix. Did we get that handout? Okay, so, and we'll go back to this throughout the evening here, so I just wanted to highlight that. So in regards to some of the current city services that are impacted, I did want to touch on that. So as we sit here tonight, this is for the council and even for the public, just to kind of highlight some of where we're at in regards to city services. Currently, both the senior center and senior dining facilities within the community are closed. Now with senior dining, they provide senior dining provide food services for a lot of our elderly. That's through Lutheran Social Services, or I think they might have even changed names again. They're still providing meals, a lot of that through Meals on Wheel, and I think they're also providing prepared meals that people can get drop off and pick up. So that service is still being provided. We're just not allowing, obviously, those vulnerable populations, that 80 and over, mainly, or that 70 and over, 60 and older, mainly to congregate in those locations. That's obviously the main decision behind the senior center and the senior dining. The event center and rec center are also both closed. Most of that having to do with the fact that large congregations are, there being the recommendation that it not be gathering in those. And in regards to the rec center too, we've had a lot of programming that we've had to cancel or have had canceled on us. Just for your guys' knowledge, we are issuing refunds for anything that was scheduled that had to be canceled due to this COVID-19. Pioneerland announced today that the library is closing today at 6 p.m. and that will be until I think through the rest of this month. We also received notification today that the Thursday driver exam testing has been canceled for the rest of the month as well, which for any of you that's been here on a Thursday, you know how busy and how crazy that gets. And then we've also halted rental inspections, mainly just due to our staff going in and doing in-home inspections into those facilities. So as we look at other facilities as a whole within the organization, obviously water and wastewater are still open, but that has no public contact. So those are pretty contained in themselves. Creekside is still opening and operational. The liquor store is still open and operational. This facility is still open, including obviously the DMV, and we're still taking payments, although we are encouraging, or will be encouraging people, you know what, if you don't need to come to pay, if you can pay online, if you can drop things off in the box, please do that. The one interesting thing, I'll be honest, my two biggest concerns, especially for contact with the public, is the DMV and the liquor store. I was a little disappointed in the state's response, basically saying, it's up to you guys. And if you do, you better have a good reason why you're closing. And oh, by the way, all the tabs and stuff, if they expire, they're still due by the end of the month. So that was a little disappointing to hear their response. Regards to that, obviously the liquor store's concern is the amount of contact, and we've tried to, just do the best both at this facility and that facility of encouraging people with the social distancing, with trying to pay with a credit card and not cash, and so that's kind of where we're at, I guess, as in regards to an organization and an operation. And currently too, we are having staff that's reporting on a consistent or on a day-to-day basis. We have not adjusted any of those schedules. I say that and I note that to say that a lot of the facilities around us are closing. The county announced today at 4:30 they're closing all of their facilities. It's obviously something for us to talk about and to consider. From a staff's perspective, I feel pretty comfortable in most of our, this facility have the ability for social distancing. Obviously, though, we do have 3 locations that deals with the public, being the finance counter, the planning and zoning counter, and the DMV counter. So those are essentially some of what we're seeing right now for impacts, if you want to say, in regards to the services that we're providing to the community. Any questions, comments on any of that?
Has the state given any indication if they're gonna cut back to essential service levels?
I can't say I've seen anything.
I haven't either.
So, speaking of essential services, because I know that question does come up, and this is laid out in our pandemic plan, but this is what we've listed as essential services: keep power on, keep water running, maintain law and order, provide information to the public, maintain calm, care for the sick. I mean, most of that obviously is provided by a healthcare system, but we talk about ambulance, EMT, remove house deceased, maintain sanitation, remove garbage. So that's what we were listed as essential services. I've been in contact with Jeremy up at Hutch Utilities. They're obviously doing everything that they can to continue to provide those services and have no desire to really change any of that in regards to the service they're providing.
So there's been talk about no disconnects during this time. Is that something that would be done too?
You know, the utilities did announce that they're not going to be charging any late fees. Okay, you can turn that back on. And they're not going to be doing any disconnects in regards to utilities, at least I think for the next few weeks. One of the things that we did want to discuss tonight, and I guess what's being proposed by staff to the council, is that we look at doing something similar with our utility billing. Specifically, that there would be no penalties for late payment after March 27th, which is the current due date. The delinquent notices that are usually sent will not be sent come March 30th. No water service shutoffs on April 7th, which is our normal shutoff date. And then obviously we'd be reevaluating that. Our plan would be to reevaluate that at the end of April. And so that's one of the things that we're going to be questioning. And during that same time, we'd be encouraging payments to be made online or in drop boxes, and that, and obviously if, for those that are struggling with payments, that we'd be working with them, even if it's something like $5 a month, just so that we're aware of the situation that they're in. And so that's obviously something that we're willing, and I guess asking the council for, the okay, I guess, to look at doing that as we move forward, obviously in these, challenging times for everybody.
I think with the restaurants and stuff shutting down, I'd be all in favor of that.
I would agree.
I agree.
I think just for the council's knowledge, we call this meeting as a informational meeting. We've got a meeting on Tuesday. Some of my plans tonight is to, I guess, start preparing for that, knowing, wanting to have these conversations. So, we'll be having those communications then with the public, and we'll prepare things for next Tuesday for some of those formal actions from the council to move forward on those types of areas.
Is there concern with staff, in some of those contact areas still? Do we have sanitation, gloves if you're exchanging money, things like that?
We have not gone down the road of gloves. I know it's something that we talked about. One of the things we are doing, we've got cleaning supplies at every one of the front counters, hand sanitizers, obviously. We've talked with our cleaning crew about doing some more deep cleaning within the whole lobby area on a more frequent basis, and including our staff to make sure that they're cleaning those areas. Based off of kind of where our discussion goes tonight, it's more of that communication with the public. Hey, if you don't need to be here, just like kind of everywhere else, don't come. We've got the outside payment boxes that can be handled. We've got, payments online. We can obviously we can't take transactions over the phone, but we can have conversations, with people over those phones. If you have to come in to pay, use a card. We prefer not to deal with cash, either a card or a check. And those are some of the concerns that obviously we have. I will say the last couple of days, we've seen
Slow down.
a slowdown. Like I said, my two biggest concerns are both the DMV and the liquor store. Mary has stated they're doing what they can to make sure everything stays as clean as possible. Obviously, the one concern for us is, places are closing that down. If that's something that we want to do, it's a service that's not going to be available then, because the county has announced they're closing their service down. Not saying that doesn't mean that we have to stay open, but those are concerns. Obviously, speaking with Candace, she believes they've got things in place to handle this as much as they can. And that's another area where we'll continue to try to stress to people that, have respect with the social distancing, pay with cards. Even, unfortunately, these are some of the interesting things that you find out with state law. Can't do drive-ups. You can't purchase alcohol outside of the facility, so they have to actually,
Can't
come in.
deliver it to your curbside?
Yeah, can't deliver it to curbside. In the conversations we have had with staff, and even when we look at our pandemic response plan, there's no cases in town. We're comfortable staying open. Obviously, I'll say this, it sits on my shoulders when I look at everywhere around us is closing. So that's something obviously for us to have a conversation about. At this point, I'm not looking to invoke essential services. I think there's plenty of stuff for us still to do, but that's something that we would have to take a look at and consider as this continues to move forward, as we don't know, where we're looking at how long this is going to last. And some of the feedback we've had from, at least I've had from staff, is, some of the concerns on future employment and paid leave requests. Our current policy that's in place, and there's a discussion on here of updating that. Right now, if we were to send employees home, they have to use a vacation. Obviously, we just had spring break. We had a lot of families that were gone and used that vacation. I propose some options that if we do get in the mode of sending people home, that we look at establishing a pandemic leave balance. I've offered, through conversations with Brenda, we've offered two solutions. One is establish a bank amount. I think I've got 3 weeks in there for both full-time and full-time, part-time, or something that just says we're simply going to pay you through the whole time frame of this pandemic. We've seen a little bit of both across all spectrums of the workforce. We've seen private companies that say, hey, we're going to continue to pay you for the next 2 weeks if you send you home, and we've got some that say we're going to pay you no matter what. But I think, especially for the livelihood of those that work for us, it would be my recommendation that we look at establishing something for them if we get into that case of the need to send them home. So obviously we've given you that, like I said, that proposal has been in front of you. I sent out, obviously it was late today, but for you to take a look at. I said I don't even necessarily need to know today, but it'd be something I'd like to bring forward at Tuesday's council meeting.
So Matt, for just for clarification, so you're proposing a policy for paying employees if they're sick and go home, or if their job isn't necessary?
If we send them home based off of our essential services
Okay.
plan. So obviously if they're sick, they've got sick leave for
Sure.
that, and if there's, obviously vacation, if they were to happen to get sick, that's covered under the the plan outside of the workplace, and there are workers' comp things that come into play too for our public safety officials that would happen to be infected by.
So also for clarification, are the county, are they not doing anything? Like their building's closed to the public, but are they there?
They're still there, yeah. That's my understanding from what I've heard. And it came out late today that they're
Okay.
still having all their employees report.
And so the state still require, like the DMV, for example, they're still requiring the,
We have to, this is what, no. This is what their statement said today. We have to request to close, and we have to give a reason why we're looking to close.
okay?
Okay. For both the DMV and our liquor store?
No, the DMV.
Just the DMV?
the
Because
DMV.
this one is city-owned.
We're responsible for the liquor store.
Right, right. But both those entities are dealing with the majority of the people.
Yep. are
Would that
coming into-
reason be simply to deal with this? I mean, is that enough of a reason that they're looking for,
Well,
or?
yeah, I mean, obviously, that's what, I mean, there's places that are closing down
Sure,
the DMV across the state, so,
so then people would have to go online to do their DMV business?
yeah. And I think, I'll be honest, I think there's some concern from the state of losing out on revenue and whether or not their online system can take it.
Hold it.
What could go wrong?
Yeah, right.
Just a couple of things too, from operations standpoint. Really outside of Park and Rec at this point is probably the main department that's been impacted. Right now, all the other operations are operating as is. And we've also set up coding. This is more the financial coding has been set up for, in the case that we need to start tracking costs and expenses related to this pandemic, and, you know, in case there's state and federal money that will come down as we look, you know, to the future here. A couple other things that I want to highlight. As we know, we've been in contact with both the county, school, utilities, hospital. I've been having communications with the staff and the directors, and we've been talking about things like meetings and travel, obviously social distancing, you know, all the other recommendations, washing our hands, if you're sick, stay home. All those communications have taken place. One thing that we are continuing to do is we are doing building inspections. We are still getting requests for building inspectors. You know, so as I look at that, there's obviously with the economy being hit as hard as it is, we feel like there's it's still something that we can provide. And speaking with our inspectors, they still feel comfortable with doing that. Those settings aren't necessarily one where they're dealing with a lot of social interaction. So we are still providing building inspection services. And one thing I do want to point out, because unfortunately I did receive a phone call today, there are no city inspectors out there enforcing social distancing. I had a retailer call asking for the city's updated ordinance because they had city staff in there asking them to enforce social distancing. I said, who from city staff is in there? Well, they didn't catch their names, and I said, we don't have anybody sent out doing social distancing, so that's important for the public to understand. We're not out. First off, those are recommendations by the state and federal government that we support. There's no criminal law attached to the fact if you don't abide by that. But unfortunately, and as we see in all these types of situations, people take advantage of it. But there are no inspections that are taking place in regards to social distancing within operations and facilities. As we obviously look to go forward with future council meetings, we've met here tonight as a group. Cities are starting to look at alternative ways of doing that. I know our EDA is going to be looking to do teleconference for their meetings, and that is a potential solution for the council as well. Something to think about. We don't have to meet here. If we decide to go down that road, there are steps that we need to take to make sure that most likely Mark and I would be here in this building as a part of that conversation, and then that communication needs to be available for the public to at least hear and be a part of. All the things need to be done by roll call vote. I don't think we're set up quite yet for doing any type of video conferencing, but that's an option as well. And as we move forward, quite frankly, this is what if we decide to continue to meet, this is what our council meeting rooms will look like. We'll enforce the social distancing. A couple things that we have to keep in mind at this point, we've got a public hearing that's coming up on March 31st. I don't know at this time if there's an opportunity to cancel that. I don't see that. And so we're going to have to start making plans for dealing with that, dealing with those, that aspect of social distancing. And so that's why we've now obviously opened up the lobby, and those will be conversations I'll have to have with Kent on how do we handle a public hearing that may have a large group of people that attend. And so those are things that obviously we're working through. And so obviously those are things to keep in mind if we want to change the way that we're doing our meetings. Those are obviously things that we need to keep in mind too. If we do decide to close our public facilities, there's still things that we have to meet in regards to an obligation. So.
And that public hearing is required by law.
Yeah.
And would have an impact on the project, would it not, if we
Correct.
did not do that? So,
Yeah, I mean, in conversations with Kent and with Public Works, there's concerns on whether or not MnDOT will execute
so I
that
was gonna
contract.
ask, yeah.
Now, we have no indication that they won't. And until we get some indication that they won't, we need to move forward as planned. If they don't, we're not looking at a project this year. And right now, there's been no indication that's not moving forward. But, one thing, and I didn't say this, and I should have said it at the very beginning, this changes every day, every hour, every week. Tomorrow could look a whole lot different. And so that's some people might get, why you say the city sending out so many communications, social media, because what happened today changes what's going to take place tomorrow. So we're trying to stay on top of it as much as we can, and that goes for projects that we're facing. So obviously from administrative side, obviously this has taken up a lot of our work as we're getting ready to plan. I'm sure both Mike and Tom can say the same thing. And with staff, hopefully I know our directors are having conversations with their staff about, what this might mean and what this might look like as we move forward.
Would the technology be available to have our meetings at the big room in the event center? If we're gonna have a public hearing, I mean, because we're pushing it in here with the 6 feet, and we're playing fast and loose with 6 feet up here.
Yeah, and I think that's, I think that the ability to have a meeting, yes. I think the one, this is probably a conversation we need to have with HCVN, is the ability to broadcast that on TV or online. Now, I started in a career where there was none of this was covered on TV or online.
That's not a requirement,
So if it's
What is our obligation for that? I mean, do we have to put it
show
on
it on
TV?
TV or
Yeah.
HCVN, no. Our only obligation is to ensure that it's open to
Okay.
the public. So, and then when you get in states of emergency, Mark, I don't know if I want to put you on the spot about what our options are when it comes to states of emergency and meetings and what we have for what we can and kind of can't do, or what are different options that are available to us. So,
Well, certainly, with regard to the process, I don't know if you've talked about the process at all, but I know earlier on, Matt had talked about that the mayor has the authority to say that a state of emergency exists within the city. When the mayor does that, the city council has to ratify that within 72 hours, so there would be a meeting of you as a group to confirm this decision to say that the state of emergency exists. As the chief had mentioned before, that opens up the door as far as lessening some of the restrictions that the city has as far as purchasing and things like that. So you don't have to abide by the bidding requirements, things of that nature. With regard to meetings, you still have to abide by the open meeting law to the extent that you can. So if there is something during that state of emergency that actually is an emergency, and I think everyone agrees that this pandemic is, you still have to be able to provide as much notice as you can to the public and to the media when and where you're going to be meeting. And then those meetings take place pretty much as normal, except for some of those variations in purchasing that I talked about. You talked about, a second ago, you talked about the public hearing that's coming up. I believe that the public hearing has been set for this location. And I don't think at this late date you're able to change that as far as the publication requirements for the public hearing. I don't know if the public hearing date itself can be pushed back to accommodate any new publication date. But I think because the notice went out that it was going to be held here, it has to be held here. I don't know if there's any accommodations that can be made as far as, limiting the participants that come into this room. If there's other areas of City Hall where people can congregate and listen to the hearing as it's going on, and then one by one be ushered in if they want to speak about it. But as far as changing the location, I don't think that can be done because it's been published to be here. Something that might be able to happen, I guess I'd have to check it out, is for the public hearing to be called to order here and then recess to a different location and then reconvene at the event center or wherever you as a group decide to recess the hearing to.
One of the things that Kent and I have talked about is something to what Mark said. We've got the lobby, obviously, depending on what we have, is something along those lines of, we've got room in here for about 10 people. And, that's probably your limit, and then you usher them out and you bring in the next 10 or whatever you have for something like that, so.
Obviously, to the extent that it's possible, if city staff can address any concerns prior to the hearing, to try to answer questions from the public, that might cut down on the number of participants at the hearing. Obviously, when you think about our ideals in democracy, we want as much participation as we can, but these circumstances perhaps warrant a different approach.
Would say as far as the event center, I believe that is wired for HCBN. We had some meetings up there before. I think
We've had a
there's
debate
been
up there.
some election things, yeah, so.
And like I said, I think there's obviously they've done other events within the community that, probably, I don't know about the streaming online, but that's, I think there's possibilities as long as they have the time frame that's to notify what our plans are, so. A couple things I think are important to address even from our position. I think both Mike and Tom did a good job of saying, I think when you look at it from the government's perspective, I want to emphasize that, and the government being the city of Hutchinson, I feel comfortable in where we're at for preparedness. With that being said, this is changing so fast. I don't know. But I think it's important that people realize, don't panic. It's funny, this whole toilet paper thing, because luckily CNN came out saying there's no shortage. There's no shortage and there's no reason to act the way we are. And I'll say this, we do our best treading information out as much as we can. I'll say it in one sense, and in another sense, the last 2 days have probably been some of the busiest days we've ever had at our liquor store. Because people thought the liquor store was closing in regards to the bars and restaurants in town as well. So there's no need to panic. Obviously, this is a new situation for a lot of us, and even those of us that are working in local government, this is new for all of us as well. So obviously, a couple things I think we're looking for direction from the council on is the operations of the city. Right now, like I said, outside of really park and rec, we're operating as normal. But with that being said, we do have employees who have spouses that are essential workers, especially when it comes to healthcare. you know, they're needing to they're needing to take some time off. Couple things that, you know, like I said, water and sewer, we're providing that. Those people are gonna be here every day. You know, I still think there's opportunities to take care of our parks and take care of our streets, obviously, as long as we keep in mind some of that social distancing. Noting right now, we don't have any cases in the community, at least that have been identified. You know, we've got things like the liquor store in Creekside that operate as a business, that have business pressures on them, just like the rest of the economy. You know, specifically, when I think about Creekside, you know, they've got a customer base where if they take off, the rest of the competition isn't, because it's private. Obviously, there's no need for the public to be out there. There's no need for them to have public contact, and so I think there's ways that we can easily address that. You know, whether it's fun or not to talk about, we are the only we're the only liquor store in town. And so if there's a desire to close that down, all I'm telling this council, we need to keep that in mind. Candace has told me at this level, at this point, they're comfortable continuing to provide service to the community.
Have you heard, so a lot of big stores like REI and that type of level have been closing for the month. Have you heard of any other liquor stores, like privately owned liquor stores closing?
I can't say private. I know there are some public
Sure.
liquor stores that are closing. I will say this, if you're Brooklyn Center, you can, I want to say you can close your liquor store. It's a lot easier to close your liquor store in Brooklyn Center when you can drive 5 miles to,
Another one.
you know, Total Wine or whatever is within there. You know, this is the interesting thing right now. I'd say it's 50-50, you know, when it comes to public buildings, those that are closing. I mean, a lot of them that are closing are kind of closing everything. Those that have municipal liquor stores, it seems like half of them are keeping them open, the other half are closing them, down. So I don't know what you know, I'm looking, I hate to say it, I'm looking at it more from the business model of it and the impact on the community.
Well, I think as long as Candace feels comfortable keeping it open, I think that's, you know.
Think it'll change when,
Well, like I said, and we could be,
Something comes up.
tomorrow could change
Yeah.
Right.
a lot of this.
Right. If we end up with an outbreak in our city or in our, even, you know, even close to us, that could change it just like that.
And so I think it's, you know, important to, like I said, and there's obviously things within our pandemic plan that needs to be updated. But the general aspect of it is being followed, you know, and even within that, you know, we're not at that stage of closing down our facilities. I will say though, the ones that we have closed down, I think need to be closed down. When you're looking at the rec centers, the senior centers, the senior facilities, you know, it's even interesting because in the same report that came out yesterday from the governor, he encouraged public buildings to remain open in one sense. And, you know, the library was open, obviously Pioneer Land had closed it, but we were seeing libraries across the state close as well. And so looking at the, you know, the operations of the city, obviously, and then, you know, I think the other important thing, especially for communication with our staff is, you know, what's our plan moving forward and in consideration of paying them as we potentially look at the need of sending people home and operating with essential services.
so when you say the store has been really busy, busiest, so crowded inside and. you know, so-
Yesterday they did $52,000 worth of sales. They said it's equivalent to Thanksgiving, the day before Thanksgiving.
Yeah, I've heard there's been some lineups in
Oh,
there.
geez.
Just wondering if it'd be better to line up outside than inside.
You know, and Candace and I have talked about, obviously there's some concern even with staff. So far to her knowledge, they've handled the challenge. But we may have to look at things like reduced hours, you know, with some of those, so.
And I just think of possible ways to pick it up and, you know, with again, the gloves, our masks, they say it's really more for healthcare workers. It doesn't necessarily, well, it's preventative for them. Is that
And
something?
I think it
that
doesn't
should
hurt
be
one bit
looked
to
at?
provide those options to our staff.
Same with the DMV that way too.
Obviously, there's a lot of information that was shared tonight. It was kind of tried to bring the council up to speed as much as we could on everything that's taking place. I don't know, Tom or Mike, anything that I missed, or Mark, anything that I missed? Any questions for myself or some of the staff that's here tonight? Like I said, I think, the biggest direction we're looking from you guys is, operations of the city, and then, future payments for staff.
Matt, you want to give them the numbers and how to reach City Center through social media and?
Obviously, we're on Facebook, and we're putting everything as much as we possibly can up to date on the city's Facebook page. You can find us wherever it's City of Hutchinson, Minnesota. It's pretty easy to find on Facebook. And as I noted, it's on the front page of our website. We're putting, any type of information that we get, any type of the releases that we're putting onto social media, we've got on the front page of our website. And we're even looking at some new features where that's going to pop right up to people that go and look at our and look at our pages. I've sent out a couple communications to staff. There'll be more that will fall this meeting today. But otherwise, I think the best way was it 5151, Melissa? Is it 587-320-587-5151? That's the main, that's the main administration line to get in touch with
Matt,
with
one of
staff.
the most, I think one of the big important things are scroll way down once on your, the one where it says help stop rumors, know the facts.
And a lot of this stuff, most of the stuff, I'm gonna be quite honest, we're not making it up as we go. A lot of this is coming from the CDC and the Minnesota Department of Health, and I'm gonna tell everybody, as we've tried to with our press releases and our social media releases, those are the two best sources to get up-to-date information on the recommendations that are going forth. The city stance at this point, unless there's some other direction by the council, is that we continue to support the recommendations that are being put forth by the CDC and the Minnesota Department of Health in regards to how the public should be responding to the coronavirus.
Don't you believe at this time that we've been as proactive as we can get? Isn't that factual? So everything else is going to be reactive to what happens on what we're informed of, right?
I don't know, if I'm being honest, if any of the government agencies can say they're proactive on this, just because this is something none of us have seen. I think with what we know, with the resources we have and the planning that we've done going into the years into preparing to be who we are as a government, we're as prepared as we can be.
That's what I'm getting at. We're just prepared as much as we can
Yeah.
for what's happening at the moment in time. So
Correct.
I guess that's what I meant by proactive to that point. So.
With the discussion Tuesday about, the benefits that we could provide compensation, which I believe, we should have something, but at the same time, the federal government sounds like they're going to be through this bill, and who knows what that will be. But would, that be taken into consideration when that becomes clear? I mean, if it's a long-term thing and, there's federal assistance or, available to make that up, then, would.
Obviously, that would be taken into consideration. I'm going to be honest. At the end of the day, I'm going to respect whatever decision we make as a council. I'm trying to be as stable leading with the staff as I can be. And I'm looking at what other government agencies are doing, what other private businesses are doing. Obviously, it's not the same across the board. And then they've come out and said, you know, for the next 2 weeks, if we send you home, we're paying you.
Yeah.
You know, that's one of the options. I think I've got 3 weeks in there, is what I've provided. Obviously, if this goes on for a long time, that's something that's going to impact us, and I think your guess is as good as mine when it comes to the federal government's support and for the public on that. Obviously, that would be something that would play into it, assuming, you know, vacation and sick leave gets, you know, exasperated. I think one of the things that we found out as we looked at this, you know, right now, if we were to send somebody home because of the coronavirus, they can't use sick leave. They have to use vacation or comp leave. Now, you know, as we've looked around, there's other organizations that pandemic leave falls under an eligible use for sick leave as well. And so you've got some employees who might have a day of vacation because they were just gone on spring break.
So our insurance does not cover that, that's what you said?
Our insurance would not cover it. Correct, Brenda? It's not no. I mean, it would cover, they cover obviously if you get sick. You know, that's an
Or
eligible.
if you're quarantined, or not even that?
Not, I mean, if you have to be quarantined for 14 days, I don't believe that's an eligible expense to be covered. Brenda, do you know of anything about being quarantined? If that's covered by health insurance? Not that I've heard of or seen. Yeah.
How about a test? Would that be covered?
Test is covered by our health insurance. Yes. I know they sent out, I think probably almost all of the medical providers sent out notices within the last week about their covering tests and you know, obviously, you know, I've talked about operations, payment of employees, and then also future council meetings. You know, how does the council want to meet?
Well, I think we'd still meet in person, just maybe at the event center, just spread it out a little bit.
Sure.
You know, if it gets to that point where we do have this in our county, there aren't going to be that many people who want to come out to a council meeting and even be out in it. So it will probably come to that, you know. I mean, we'd have the availability for them to be there if they wanted to be at the event center.
Yeah, I mean, and if we go the route of, you know, video conferencing or teleconferencing, like I said, those are opportunities there has to be opportunities for the public to, you know, to participate and be involved in those as well. So.
Is there anything else for Matt?
I think they've done a good job in the police department, fire department. I think community should feel relatively comfortable with what's done. Thank you.
For council meetings, do we want to eliminate some of the extra stuff that we sometimes put in, like communications from staff, like annual reports and things, just to shorten meetings up a little bit, or?
That's,
Sure.
it's up to the council. I mean, we got Public Works that's scheduled. You have the one on Tuesday.
Sure.
So,
Right.
And I guess if we're having a meeting and everybody's together anyway. I guess I don't know if it matters, but
well, you know, part of the communication I'll be having with staff is, you know, if you don't need to be at the council meeting,
don't be there.
don't be
Don't
there.
be there.
And if you're there to give a presentation, you know, do that.
Then leave.
And then leave and stuff. So those are, you know, if we're continuing to meet in public, those are the conversations I'll be having with staff as we, you know, approach this. So we've obviously got a council meeting in a week that, you know, and so there's some of these things that we've discussed tonight, you know, I'll be bringing forth with, for hopefully some action from the council. So.
I think the general public, this has to be proactive. If you're sick, stay home. I mean, that's one of the, I know we're more work ethic minded people in Minnesota, where people go to work even when they don't feel good, but I think that's the biggest part is, be proactive. If you don't feel good, don't go.
And I want to say this, and first off, I wanted to say kudos to the public. I've had a lot of emails, requests about what can we do to help, whether it's the veterans groups in town, to even some of the leadership groups. And, at this point, I think the best thing that we can do is help our local businesses and our neighbors. I mean, I think from a staff and the government-wise, we feel comfortable with the staff that we have and the work that we can do. And so it's tough for them to say, what can we do to help the city? Well, really what you can do is help your neighbor, help the local businesses, help the single parents that are trying to feed 4 or 5 kids. It's really helping those people out. Like I said, well, we can operate with the wonderful staff that we have here at the city. And it's good to know that if we need some help, there's groups out there that are going to provide it. But, we feel pretty comfortable with where we're at right now. Like I said, we all know this changes a lot, but there's a lot of people, like I said, whether it's your small business or your neighbors, really to reach out to them and see what type of help they may need. And then just to follow the guidelines that are being set forth by the Department of Health and the CDC. It came out today, and I know there's been some questions about, at least daycare for some of the children at school, and I know that the school's looking at addressing that, especially when it comes to, healthcare workers and your, protective services people. But, my understanding, I'm not sure if it's come out publicly yet, but, there's a lot of questions about what about the kids that relied on those meals. I believe the school district has a plan, and if that's not out, it starts tomorrow. I think there's 6 locations within the city that provide. Yeah, and so, like I said, that's where I think we all feel comfortable, at least those of us that are working here. The communication that's taking place between ourselves, the school district, utilities, the county. It's, we talk about it in Hutch, and we get things done. This is just another challenge that we'll figure out and we'll get done.
Donations to the food shelf, you can write a check, mail it, they can buy food.
Yep.
More people are going to use the food shelf now also.
Anything else? Matt, thanks for the update, and, for the public, just, go onto the website and get your information. They keep updating it all the time, like Matt said, so, and it's factual. What Matt has on there, it's factual, so, don't believe the waiver. All right, adjourn
So move.
by Mary, second by adjourn, all in favor?
Aye.
Opposed, carried. Thanks for coming, everyone.
Thank you.